Welcome. It's great to have everybody here. We are very privileged to have Dr. Meg with us today, sharing some really important things about our kids with autism. And actually, it's going to affect all kids. It's not just for kids with autism. We know how things cross over. And we welcome all of you. We want to be sure to let you know to use the chat and keep questions coming in. And also that this is number 6 of 7 sessions together. And we've had other sessions for parents and providers. And next week on Monday night, we will be having a Q&A with all the trainers, all of the providers and the parents that presented during these sessions. So it'll be a great time to come on and get your questions answered. And just hear things that maybe you haven't even thought about. So if you want any information, shoot me an email and I will shoot you an email, or go on our website and we'll have the information is there as well. So with that, Dr. Meg, I know you this much, and what I've got to know about you, I really respect and honor, and I'm so looking forward to what you have to share. So go ahead and take it away.
Wonderful. Thank you, Janine. And thank you all who took time to be here tonight. I know it's crazy with having little ones, and especially little ones who have some different, are not neurotypical. So with that, we're going to talk about naturopathic basics for autism, specifically within the confines of nutrition, lifestyle, and sleep. And so I wanted to start by introducing myself. So I'm Dr. Meg, and I am the owner and practitioner for Children's Naturopathic Center of Colorado. I am a Colorado native, and my practice in the Highlands area, very close to where I live, and I am a mama to a dog and a baby, and sometimes my husband. And I love gardening. I'm also a social dancer, so that's something not everyone knows about me. I do a variety of social dances. I travel. These are just kind of some things that I really love and am passionate about in my life. And then kind of my why of why I chose to participate with Thrive and why I do the work I do with children with autism is in part because I see such a need and such potential in those individuals and families for health optimization. And that, as we'll talk about in this slide set, there's just a lot of areas that can be addressed that I don't think always get addressed. And so naturopathic medicine is such a great resource for those families. And so we'll kind of talk about why and give you that introduction. So what is a naturopathic doctor? This is definitely something that is kind of, coming into the light. More people are learning what naturopathic doctors are. So I wanted to give kind of a brief overview because I think it's so important to our approach and our treatment for you to understand how we sort of differ from other types of healthcare providers. And so the first thing to kind of notice is that we are trained in both conventional and alternative and complementary therapies. So, and I'll kind of speak to our training a little bit later. But we have a really wide breadth in terms of what we understand and what we know about. And that really allows us to serve patients in a very whole way in addressing all of their concerns and working with also a variety of different types of providers as well. Our distinction is ND, naturopathic doctor, rather than MD, medical doctor, and DO, which is a doctor of osteopathy. One of our distinctions here that I like to mention is we spend upwards of an hour with new patients. My new visits are about 90 minutes. So the time investment is quite different than I think a lot of people experience with healthcare providers in terms of us really getting to know the ins and outs of not just what the symptoms are and the diagnosis is, but actually what your life experience is like so that we can cater our recommendations to that as an individual and as your family. Our recommendations include things like herbal therapies, nutraceuticals, which are nutrients, supplements, homeopathy, physical medicine, hydrotherapy, nutrition, lifestyle, and counseling. We have a very big toolbox, which is really exciting and such a relief for a lot of families to know that there's a lot of options out there for their children. And our scope of practice varies by state. It's worth saying in the state of Colorado, naturopathic doctors do not have prescriptive reproductive rights. And we do not offer vaccines to children under 18 years old. In other states like Oregon and Washington's, where we have full scope of practice, naturopathic doctors act as primary care and are covered by Medicaid. So our training is kind of up to that level, but depending on which state you're in, it really dictates how you practice. So in Colorado, our role is much more adjunctive. We kind of work alongside your other care providers, whether that's neurologists, pediatricians, developmental pediatricians, to kind of provide the distinctive qualities that we do, like the herbal therapies, the nutrition. Okay, so that's kind of an overview there. I think it's important to point out, again, some distinctions of principles of naturopathic medicine. These are what really attracted me to this profession. I had a lot of experience in working in conventional care prior to learning about naturopathic medicine, and it was sort of these principles that really drew me to this particular profession. So of course, our first principle is first do no harm, which applies to most other medical professions. And of course, that's really first thing. We want to make sure we're not doing any more damage. The second and distinctive part is the healing power of nature. We call this the vis medicatrix natura, the Latin, if I can say it right. And the idea here is that it's based on inherent healing mechanisms that the body and most things in nature possess. And we really want to maximize and employ that wisdom. The body and the body systems are always trying to do the absolute best they can. And really our job is to provide them with what they need and remove barriers to that happening. So we really rely on that inherent wisdom that's kind of older and more subtle than we can really understand. Identifying and treating the cause or the root cause is really important for us. So we don't want to just mask symptoms. There's a time and a place to suppress symptoms, but for us, we really, at the same time of addressing symptoms, we want to be addressing why those symptoms are happening, and making sure that we're catering to that. Treating the whole person. This is a really important one too, body, mind, and spirit. So it's not just physiology. We know that trauma, we know that, stress and people's environment really gets into the cellular makeup of how they become who they are. And so we want to make sure that in addition to addressing those biologic pathways, we're kind of speaking to the other things that can contribute to someone's overall health. Doctor as teacher. This is probably one of my favorite ones. I think this is so important for patient empowerment. So really taking the knowledge and information and putting it in the hands of the parent, putting it in the hands of the patient, so that they really feel empowered to not just do what the doctor says, but actually know what they're doing and carry that forward to take care of themselves and advocate for themselves and their health and their world eventually. So I think that's a really nice distinction as well. And then the last principle is prevention. We are super big on optimizing health so as to prevent disease. And that's really, really a big part of what we do as well. Okay. So we've talked about the principles. This is a really other nice concept that I like to talk to people about when you're learning about naturopathic medicine. It just gives you an idea of what our approach is. So you have those expectations when, as you're going into the slide set with me, you'll have these expectations. You'll understand why I'm speaking to the things I'm speaking to. And then if you ever see a naturopathic doctor or pursue naturopathic care, you can understand what the approach is there. But we start at the base of this pyramid when we're addressing health. And so that first box down there says establish the foundation for optimal health. And this is where we address the determinants of health. So these are things like your lifestyle, your physical environment, your diet, your sleep, your stress, genetic factors. These are kind of things that socioeconomic, cultural implications, all of these things really set the stage and foundation for how your health is going to manifest. And so these things need to be addressed both on an individual level and then hopefully at a larger level as well. But we want to kind of look at these things as the first thing we look at. And so today, a lot of the things we're going to talk about, lifestyle, sleep, and nutrition, and as far as the basics we're going to discuss, really start at the base of this pyramid, okay? And then we really really can go up from there. So the next level there is to stimulate the self-healing. This is the vis medicatrix naturae. This is the self-healing mechanism in nature. And we want to kind of promote those pathways in the body. The body has these pathways already in. There's regulatory systems, there's healing pathways that are already built into the body. And our job here is really to promote and, you know, help those work really well. The next one up is to support and restore weakened systems. This tends to be specific to different areas of the body, whether it's a GI issue, you know, neurologic issues. We want to really kind of focus on supporting those more specifically with therapies, both from nutritional perspective as well as potentially botanicals, nutrients, that sort of thing. Addressing physical alignment, this falls into the naturopathic center as well, although Dr. Isaac Newberry, who will be talking as well, is a big proponent of this. Making sure that there's proper alignment in the body is really key to the way that the nerves function, to the way that the tissue functions, to even like within like Alexander technique practices, into like how your muscle memory and your brain work together. Like doing homework in a certain position might be different than doing homework in this position, and how you actually optimize. So that piece is really, really important as well, and kind of the next up thing on the pyramid. Then we get into what most people think of as healthcare. So we think of like natural symptom relief. So this is kind of, again, you go to a holistic provider and they give you, you know, herbal therapies to treat allergies or something like that. And that can definitely be within the realm of this like natural symptom relief or something to create sleep. Synthetic symptom relief is kind of next up. And then we have high force intervention. So these are things like surgical repair and that sort of thing. And synthetic symptom relief tends to be more pharmaceutical. So again, while they're in the realm of what we do as far as naturopathic medicine, they are at the top of the pyramid. So we always want to address these other levels, while we also, you know, we want to address the lower levels and eventually get to the higher if they are needed. And this is, again, not to say that, oh, we never want to use pharmaceutical medication, we never would indicate surgery. That's not it at all. It's just that we want to be addressing these other layers of the pyramid if we're at that place. Okay, so that's kind of a little bit about our therapeutic order and understanding that piece. Our training. So this is directly from the American Academy of Naturopathic Physicians. We attend a 4-year accredited graduate level naturopathic medical school, and we are educated in all the same biomedical sciences as an MD. In addition to medical and clinical sciences, naturopathic medicine incorporates natural and non-toxic treatments with a strong emphasis on disease prevention and optimizing wellness. Naturopathic medical education incorporates standard medical curriculum, and studies include clinical nutrition, physical medicine, homeopathic medicine, botanical medicine, psychology, and counseling. A naturopathic physician takes rigorous professional board exams so that they may be licensed in a state or jurisdiction as a primary care general practice physician. So that's just a little bit, kind of a lot of words, but generally speaking, just an overview of what our education is, just so you have that context. It is important to note there are people who claim to be naturopaths, and that is very different than a naturopathic doctor. So that's something to kind of keep an eye out for when you're looking for these types of providers. You want to make sure that someone went to an accredited school, received board certification, so that you're getting someone who's well trained. Yes, Janine. Oh, you're muted.
Thanks. There's a question in the chat, like, how do you really know the difference? Because I have heard, I'm assuming others have heard too, that they're naturopath. Like, how, I see all this now, and how do we really know? Like, what are we watching for as we get in, you know, call somebody or are in their office? Like, would it be like, what are things to look for?
So there are 6 or 7 now accredited schools that provide this degree. And so I think asking for the credentials of the provider, like where did they graduate and are they board certified, are 2 really good questions to ask if you are conflicted about knowing that. So if it's not clear with their information provided on their website, what type of training that they received. In general, there is a board that is trying to cut down on people using ND if they don't have a doctoral degree. A naturopath can call themselves a naturopath, but they can't call themselves a naturopathic doctor. So if there's the distinction of ND, you can always double check with credentials, but that is a good sign that they are actually someone who's graduated from an accredited 4-year medical program.
Okay, thanks for the clarity. Yeah, the chat, they said thank you as well.
Great. Okay, so where we shine. I think naturopathic doctors are great for almost anything that's going on. They can be a really helpful adjunct. But specifically, really good at addressing prevention, really good at optimizing wellness. I get sick all the time. I'm, get allergies every season. This is such a great space for naturopathic doctors to be providing recommendations that are more about those determinants of health to kind of really help support and prevent those things from occurring. Complex disorders, this is another area. Naturopathic doctors love getting into the nitty-gritty of the biochemical pathways and understanding how those impact symptoms that we're seeing, and also studying really novel interventions around natural remedy interventions that tend to have really low side effect profiles, which is lovely when we talk about kids and sensitive individuals like those with autism. GI complaints, gut health is the basis of all health. And so I think there's Hippocrates or someone who is a big proponent of that. So really important thing that we address is ensuring that the gut is very, very healthy. This is such a big, factor, and we'll speak a little bit more to that as we go. Immune imbalances are really common. We're seeing a preponderance of allergies, which are improper immune responses to things that are not noxious. So these are, again, really good times where naturopathic doctors have other tools available to them, a larger toolbox to help provide things for that. And something we often see a lot is also a lot of last resorts. They've done everything medically that's possible for them, and they're still struggling with symptoms. This is another place where they come to us and think they've done everything, and we have a whole toolbox for them to try. So really kind of just a few areas where I think there's some extra place for us to shine. So autism definitely falls into all of these categories. And so here we go. I want to also say this before we get started as well. Naturopathic medicine is very individualized medicine. Nothing is a one size fits all. And that is very, very important for people who are watching this to understand, and for patients to understand in general, that your child is unique, your living situation, your family situation is unique, your resources are unique. And I think in general, naturopathic medicine is so good at making sure that that's the case, and finding resources that really work for that family, and really workshopping how to apply it to those individuals. So I just want to keep that in mind. So the recommendations I'm going to provide are very broad today. They're not, and again, it's not one size fits all. So I want you to keep that in mind as we go through here, and take what's helpful for you and sort of leave the rest. And you always have the option to talk to someone more about it, or me. So I want to touch on that. Okay. I love this image. So we're going to start out by talking about the complexity of autism spectrum disorder. This is a really great image from an article called Modeling Autism, a Systems Biology Approach. And as you can see, there are all these contributing factors to the symptoms that we see with children on the spectrum. And they all connect to one another and feed into each other. And it really becomes this web of reactions that can be very, very difficult to untangle, and very, very difficult to understand. And more research is elucidating how these things interact and what things we can kind of affect, and really, really understanding it. And so we kind of look at this and, it's kind of, where do we start? What do we do? And so I think that's what we kind of want to talk about today, is where do we really start with this? And as autism becomes more and more prevalent, the most recent statistics are 1 in 44 children. It's just continuing to increase, and of course 4 times more common in boys than girls. We really want to find ways that we can do more to help these guys. Okay, so with this busy net involved, I'm going to simplify it just a little bit for today, because these three items really affect all those systems that we just looked at on the previous page. And there is a lot of evidence behind increased inflammation throughout the body in children with autism spectrum disorder, particularly neuro and gut inflammation, and also the connection between those two and how they're impacting one another. There's increased activation of microglial cells, which are some of our immune cells that are in our brain, as well as upregulation of certain interleukin or immune pathways that really stimulate inflammation as well. And that can come from a genetic perspective as well. With genetics, we see common factors including single nucleotide polymorphisms, or SNPs for short, that are commonly found in autism. And these things affect detoxification, neurotransmitter breakdown, how they process nutrients. And then, of course, genetically, we also see changes in the brain. Different areas of the brain can be larger or smaller in children with autism, and the connections between them are also different. Okay. And then toxicity. We're just beginning to scratch the surface on understanding what environmental factors can affect, the development of autism and then the ongoing symptoms and pathology going on. But of course, if we're saying that there's also inflammation happening in genetics that are causing for poor detoxification, these toxic factors become tenfold. They become much stronger because our body isn't able to process them. So really from this slide, I want you to understand that these kind of all feed into each other similarly to the last one. But the things I'm really going to focus on today is kind of talking about ways through the determinants of health that we can minimize inflammation, toxicity, and treat genetics and work with genetics a little bit as well. Okay. So that's where we're going to kind of keep this little thing in the back of our mind as we go through and talk about diet. So give me just a moment. Oh, there it is. Diet considerations. So when we're talking about considerations specifically for children who are on the spectrum, we want to be mindful. This is the individual quality, right? We want to remember that a lot of these children have food selectivity and sensory sensitivity already. So we can't just throw recommendations at them and say like, good luck. So that's really something I take very seriously in my office. I don't want to send people home with things that they absolutely cannot apply. It's really important that we have in-depth discussions about ways of actually applying the information that we're being given in a way that's usable to the parent. So that's really important. Parents are exhausted. So again, that really speaks to, how much time do they have to prep food? How much energy do they have to prep food? Like, what are we really looking at about what's feasible? Because that's honestly what's going to make the bigger difference for these kids. I can tell them all of the best information and there can be all this data behind it. But if parents aren't able to apply it, it's not really useful. So these are considerations when we look at diet. And then food sensitivities and allergies are common in this population. So that's another consideration in terms of recommendations. I am very careful around food eliminations in general. This is because we often find that ASD children with on the spectrum often already have very restricted diets. And so putting on more restriction can create increased stress. It can create conflict in the house. So there's a lot of things we want to be really mindful of. So today, rather than focusing on what we need to eliminate or things to take out, I want us to start looking at things that we can add, because that's always where we want to start, is adding in things that are going to be some of the more beneficial things, considering the inflammation, genetics, and toxicity factors. Okay. And then going back to the individual thing, I want you to think about this in terms of taking small bites. This is another factor. I don't want parents to go home and throw out all of something or start force feeding their child something. I really want it to be a very gradual, sustainable change. Like, what small habits can we shift to really promote health in these children, and in a sustainable way? Because obviously also big changes creates stress for these children. And we're going to understand too that they have a different level of cortisol sensitivity, which is that stress hormone. So we'll talk a little bit about that. But we know also that there's a lot of gut considerations with children with autism. There's a lot of comorbidities, including digestive enzyme activity, impaired gut barrier, presence of antibodies for certain foods. So we have all these considerations as we go here. Okay, so the first thing we're going to talk about, something to add in to our diets, antioxidants. Buzzword, right? Like everybody's like antioxidants, everybody has to eat antioxidants. So let's talk a little bit about what they are and what it means. Antioxidants basically are compounds that tend to neutralize free radicals in the body. And free radicals sound like what they are. They're these crazy little things that run around and steal electrons and make havoc, because a lot of our cellular activity depends on conformational changes. And when there are stray electrons laying around, it disrupts these changes and can cause havoc, can wreak havoc on the tissue, causing extra stress because the tissue is not able to function the way it should. So antioxidants are really good at basically collecting all those free radicals and helping excrete them out of the body. Okay. So this is really, really important. Antioxidants are also really good at protecting our genetic material, DNA and mitochondria. Mitochondria are our little energy makers in our cells. They're in every cell of your body, and they're kind of the little like energy factories, our power plants. And then the DNA sits in the nucleus, and antioxidants are really good at protecting both, again, from this free radical damage. And this really optimizes cell function. Okay. So again, we can talk about ways of minimizing oxidative stress. We're not going to touch too much on that today, but it is important to include these things. And really a lot of research shows like the more of this stuff you include, the better off you will be in general. There's like aging studies, immune system studies, there's cancer studies. Like these things are incredibly nutritious. I can't really emphasize that enough. So incorporating more of this into your diet is only going to benefit. And then in a child with autism who's having excessive degrees of inflammation and oxidative stress, which includes these little free radicals running around, these things can be really, really balancing for them, and really important, and also really good for gut health. So vitamin C is definitely one. It's important for immune function. It's basically the ammunition that the immune system uses to fight off bacteria and infections. It's important for bone and tissue health. Vitamin C is actually necessary to create collagen. So we talk about that healthy aging and skin, wound healing, all of that. Vitamin C is very important for recovering those tissues. Detoxification in the liver is very important there as well, and neutralizing free radicals, as we mentioned, just as an antioxidant in general. So vitamin C is very, very important. And most of our food that's been highly processed, overcooked, that's not fresh, the vitamin C tends to decline. It's not like a super stable substance over time, especially in food. So we want to make sure we're eating these things like raw and fresh and gently cooked as possible to preserve that vitamin C. Okay. Vitamin C also helps with iron absorption as well. So things like calcium actually block iron absorption, whereas vitamin C actually aids in iron absorption, which is one of the common deficiencies we see in autism. So let's talk about a couple sources here from our diet. Bell peppers are actually one of the highest sources of vitamin C. Not everyone knows that. Everyone thinks oranges or lemons or whatever. Citrus is up there, but actually these things I've listed mostly in order of how rich they are in vitamin C. So bell peppers are a great one. And bell peppers can be a little bit easier to get into kids than some of the cruciferous vegetables. So even like a red bell pepper hummus, if you make it at home, or something like that, can be really, really nutritious, and kids tend to like love dips or smeared on toast or their favorite cracker or their favorite crunchy thing, whatever they are able to eat. Sometimes just adding a little bit of spread or something, if they'll tolerate it, is a great way to increase nutrient density and get a little bit of that extra vitamin C in. Okay. Cruciferous vegetables, these are a little tougher. These have a lot of vitamin C, but they also have so many other health benefits as well, but they tend to be a little bit more strongly strongly flavored because of their sulfur containing components. So, you know, sometimes blending into smoothies can be really helpful for this population if they're not eating it straight. I'm a pretty big proponent as well of making sure things taste good and taste good to you, so they'll taste good to your kid too. So finding ways of preparing these items that actually really taste good to you, oftentimes adding some oil and seasoning are really key, and not overcooking. So those are some key components to making sure these things are really digestible. Guava, papaya, kiwi, these are sweeter that tend to be sometimes a little bit easier. Papaya also has some amazing enzymes that help with digestion, but these are all super rich in vitamin C. So again, baby steps. What's one way you could incorporate a little bit of this into your child's diet is sort of the attitude we're taking here. Okay. Wonderful. So then we'll talk about polyphenols. Polyphenols are these plant constituents or micronutrients that are comprised of multiple different rings from a chemical structure and biochemical structure. And that's really helpful because it means it's very stable. And that stability is what allows it to, again, neutralize free radicals and really help with antioxidants within the body. And so some of these polyphenols that you might have heard of, these are all polyphenols, include quercetin, resveratrol, that's our wine one that everyone likes to talk about. EGCG is within green tea, and there's some good studies on that with cancer. Flavonoids, and curcumin. Curcumin is the one that's found in turmeric that's very anti-inflammatory. So again, kind of funny words, but really what they are, and there's thousands of different types of polyphenols. These are some of just the more popular that have more data behind them. And really the way that we get these is to eat the rainbow. As many colorful fruits, vegetables, and spices as we possibly can. And so this, again, can be tricky in kids who eat a very bland brown white diet. Okay, so getting creative around the language you use around it. I often tend to, like, if Shrek's now, I don't even know how old that movie is, but Shrek soup used to be like a popular thing. You know, I don't know what exactly the new things are, but, you know, using fun ways of incorporating the colors in a playful way can be really, really supportive for these kiddos. And then, of course, incorporating these things, especially spices and things, into foods that they already eat potentially. So curcumin's a really good one, a very anti-inflammatory that can be really helpful. You can add it to rice and it gives the rice a little bit of a yellow color, but not too much flavor. So those can be really easy ways of incorporating those in as well. But playing with smoothies, blending these things into baked goods, all of those things, but the more color, the better. That's going to have more polyphenols in it. Oftentimes it's the skin, like the tomato skin, the grape skin, that really contains the highest amount of these substances. Okay. So getting a little creative with the way that we use those, and try to avoid peeling stuff unless it's something meant to be peeled, because those peels have a lot of nutritious value to them. Okay. All right. Our next bite, healthy fats. This one is really, really, really big. Omega-3s for sure. I'm sure everyone's heard a lot about omega-3s. The distinction that's so special about omega-3s is that, as opposed to almost all of the other fats, pretty much all the other fats from a biochemical standpoint, these ones, when they are incorporated into cells, whether it's the membrane or other parts of the cell, they break down into anti-inflammatory breakdown products. So they are extremely, extremely anti-inflammatory. And I also always like to mention here that the brain is a very fatty place. There's a lot of fat in the brain. So the brain really thrives on these really, really healthy fats. And we don't get enough of them. The percentage of omega-3s to like omega-6s and 9s is really off for the standard American diet. It really should be shunted way more towards omega-3s. And so this is where we talk a lot about eating more fish, and especially for kids with autism too. Now, we want to be mindful of doing low metal or low mercury fishes. And my advice around that is to opt for the SASH, SASH, so salmon, anchovies, sardines, and herring. Those ones tend to be the lowest in mercury. And so Ways of incorporating these, definitely, you know, if your kid's not a big fish eater, you know, tuna salad can be made with sardines instead of tuna very easily. And sardines are actually a super nutritious food in terms of the omega-3 content as well as calcium content from the breakdown of the bones. So really, really good source of fish. Fish is actually kind of the easiest and highest dose omega-3s in terms of, you know, per ounce. So really good source if that's possible. Other options are, oh, Janine.
Can you say that acronym again? There's a question, I want to put it in the chat, or we could write it in the chat. Could you say that again?
Sure. It's SASH, SASH. And it stands for salmon, anchovies, sardines, and herring. And these tend to be the like lowest mercury fish available, which again, with children who have poor detoxification pathways, we really want to minimize any of those toxins coming in. So while we want the omega-3s, we don't want those coming in with any excessive amounts of toxins from their environment. And the reason we opt for those fish is because they're smaller and they've been alive a less amount of time, which means they've accumulated less toxins. And so that's kind of how we view that. Nuts and seeds also have excellent profiles, particularly chia, flax, and hemp seeds are all really amazing and have really good taste profiles overall. If your child likes something that's like slightly nutty or a little bit crunchy, there's ways of incorporating those into the smoothie, topping yogurt, putting it in cereal, topping pancakes. They're great things to have on hand to really help with that, or putting them into crackers or whatever. A lot of companies even sell crackers with these things already inherently in them. So that's a really great way to get a little bit of extra omega-3s that way. If your child doesn't do fish or whatnot, seaweed options. Sometimes kids like the crunchy seaweeds that are available at the store. This also has some omega-3s in it. Grass-fed animals tend to have higher amounts of omega-3s than grain-fed. So that's a consideration too if you have a meat-eating child, of kind of opting for the grass-fed whenever possible. And avocado also has a really nice profile of omega-3s. So thinking like guacamole, which can be spread on a cracker, just ways of making these foods accessible to you. So this is again where the individualization comes in, and we talk about what your child actually eats and what we can actually incorporate in a realistic way. Okay. Medium chain fatty acids. This is another really, really great one. These are interesting because they're absorbed differently than other types of fats and have a lot of interesting data around brain health as well. But for children who have a limited diet, who might be having trouble gaining weight, which can be a common finding as well, they skip part of the digestive process. So they're absorbed more directly than every other fat. And so this can be really, really great. So the main source of MCTs, or medium chain fatty acid, is coconut oil. And coconut oil has some other really great acids in it that are great for the microbiome. So a great consideration if your child has any allergy to coconut is employing coconut oil for baking, sauteing. It's a really great versatile oil if your child will tolerate it. Also using like coconut oil canned, like coconut milk, which has a lot of the fatty components in it, is going to have some of that coconut oil as well. And one of my favorite recipes is like coconut milk poached fish. So I have a lot of good luck with kids liking that. It's fairly like sweet and delicious. So Google that if you are looking for a recipe to incorporate both your medium chain fatty acids and some omega-3s. Okay. Okay, dietary fiber. This is another huge one that we talk about with optimizing the microbiome. Fiber is the main constituent that your gut bacteria feed on. And gut bacteria, we are learning, is more and more a huge part of our determinants of health, is how healthy our gut bacteria is. We have far more bacteria in and on us than we have human cells. So we're very symbiotic in that way, that we live with these bacteria and they have a lot of interactions with our immune system and with our cells that really dictate inflammation, how our immune system functions. There's all sorts of fascinating research around this. And also there's even been studies within autism, and it has the potential to improve antisocial behavior, as well as gastrointestinal microbiome health in children with autism. So increasing fiber is a really big one. It also promotes regular bowel movements when combined with proper hydration. You never want to go high on fiber without also increasing water, because that can lead to constipation. So you want to make sure that both are incorporated at the same time. But our diet, our fiber intake as Americans in general has gone down dramatically year to year to year to year. We just don't eat as much or have as much diverse fiber coming into our diet. I think, we used to get historically upwards of like 70 grams of fiber a day, which is just a tremendous amount. And now like most people get like under 10. So really we would like to be seeing more fiber in the diet to promote that healthy microbiome and really like healthy intestinal lining as well. Okay, so our sources here, legumes and beans actually have a really nice fiber profile, both soluble and insoluble. Vegetables here, fruit and whole grains. So these are kind of very general recommendations, but when you're opting for what your child's eating, looking for the higher fiber option is going to be kind of the easiest path to this. If you're buying crackers or cereal or whatever it is that they are eating, really opting for that higher fiber option. Nowadays, they even make pastas that incorporate bean flours. And so these are going to have higher fiber profiles. This can also improve satiety. Kids tend to eat less because there's also protein and fiber involved. And so, making sure that they're getting an adequate amount to feed that microbiome is very, very important. All right. So now we're going to jump over to lifestyle considerations. We've hit on diet. We've hit on 3 kind of major things to include in the diet. And now we're going to talk about things to include in lifestyle considerations. Here we want to look at limitations due to behavioral and sensory symptoms when we're considering lifestyle recommendations, parental family time constraints, access, and safety. All of these things are considerations when we want to make recommendations to families and find ways to make it really applicable for them to do some of these things that we're going to talk about. Okay, outside time. Naturopathic doctor, right? Nature. This is, and I love that there's more and more research coming out about this. There's several studies of improvements in social and behavioral factors in young children with autism. There's a really amazing book, more with regard to ADHD, but called The Last Child in the Woods, that's chock full of data about children in wild spaces and the improvements in their neurologic functioning and behavioral functioning. So I really recommend getting outside as much and as often as possible. This is hard in COVID times where we've all been really cooped up in our houses. It's a really great time. The weather is getting really lovely right now for everyone to be getting outside. There's just so many benefits from the study perspective, but then we think about like fresh air and vitamin D and all these things we're also getting from the sun. So grounding is kind of an interesting one. For those of you who don't know what grounding is bare feet on the ground, bare feet on the ground. And it can also be called, it's earthing is another term for it, but there actually is like an electromagnetic pull to the earth. And we also are electromagnetic beings. Our hearts create a field because of the electromagnetic circulation of the heart. And so these things, while we don't fully understand the implications, there is studies on wound healing, chronic inflammatory conditions, and immune response for grounding. So get outside barefoot is really like my advice there. I think there's a lot of benefit to it. And I think any mom will tell you if their kid's outside all day, they sleep a lot better at night. So really, really good benefit there. Full spectrum light of being outside, we're going to talk about the impacts on that with melatonin and sleep as well. So just getting that bright, direct light can be really, really helpful for the circadian rhythm, as opposed to all the artificial light we get from inside. So, yeah, some really great benefits here. I recommend at least 60 minutes a day if possible. And then parental care. So this is kind of the mental emotional part I'm just going to touch on, and I could talk about this, I think, for a whole session. But making sure that parents are supported in this lifestyle process is huge. There are studies talking about the impact of perceived support on actually how children are doing. So sometimes we think that by killing ourselves, we're helping our children. And I think actually what the study even shows is that if we actually have support that we need, our children are doing better. And so I think this is a really, important reminder that parents need care too. And if this does anything, I hope it gives parents permission to allow themselves and permit themselves and give themselves space to actually receive the care that they need. Okay. This also is reflected if parents are better supported, they have better regulation in their bodies, and with social and emotional support. And this has tremendous impact on our kiddos. Our kiddos are so sensitive and really perceptive of how we are. And so those mirror neurons are firing, even if we're trying to pretend that we're not stressed or pretend that we're not tired, the stress response can still be circulating. So I think just really tuning into that and being aware and giving permission to get that support, whether that's counseling, a night off, whatever it is, go see a movie, take a nap, read a book, find that is important. It may sound very frivolous, but it actually is very important. And I think that's the thing I want to emphasize here. And also just basic needs. This comes back to my mantra about physiology first. If you're hungry, you need to eat. If you're thirsty, you need to drink. If you're tired, you need to rest. So meeting those very, very basic needs for the parent is going to have positive impacts on the child. So this is where we're talking about treating the whole person. We're treating the whole family when it comes to children. And so really addressing and finding creative ways of making that happen for parents is part of the discussion that is important to have with lifestyle and determinants of health. There we go. Okay, sleep considerations. We have to think about school schedule, wake up time, when kids have to be up. We think about sleeping layout and arrangements, whether parents or children are sharing rooms with parents or sharing rooms with other siblings or on a separate floor, or, kind of safety concerns around this too, as well as noise sensitivity. These are kind of common things that kind of come up with children with autism that we want to make sure we're considering when we look at these recommendations that we're going to make here. Okay, melatonin and cortisol in autism. So the circadian rhythm is really dictated by the circulation of melatonin and cortisol. And what we see in the research is that children with autism tend to have circadian rhythm disruptions. Sleep is one of the big components. It causes a lot of stress on families, and poor melatonin production can be a part of why that is happening for these children. Cortisol levels is also something. So melatonin is kind of what brings you down. Cortisol spike is meant to happen first thing in the morning and kind of wake you up. But if that cortisol spike happens in the middle of the night or in the middle of the day or in the evening, we tend to see dysregulation in kiddos. So studies show that high evening cortisol along with HPA axis dysregulation is common in autism, especially it tends to be more correlated with lower functioning individuals. And then the other thing we understand or know about cortisol with autism is that they tend to have elevated cortisol to novel stimuli or social situations. So a neurotypical child that's approached by another child to play does not have a cortisol response or a stress response. However, a child with autism who's approached to play by another child does have a stress response to that. And so there's extra stress and cortisol being pumped through their system. And this can really, contribute and perpetuate to this circadian rhythm disruption. So poor falling asleep, not staying asleep, waking up at odd times, which is really commonly what we see with the sleep disruption around autism. Other causes of this disruption can be genetic. Remember we talked about genetic factors. There can be those polymorphisms, those SNPs in what we call clock genes. So these are what actually help us have that more night sleep wake cycle. So there can be disruption in that as well. So these are considerations that we're going to talk about here. So how do we support melatonin? And again, these are not going to be from a supplemental perspective, although supplementation is an option and there is good safety data to support it. I do advise checking with a healthcare provider before starting melatonin and to check in with them about dosages that would be appropriate for your child before initiating that. But there is good data around that. But there's other ways that we can support melatonin in addition. And so here's a couple of them. The first is having a cool, dark room, cave-like, really dropping the thermostat, blackout curtains, and turning down the thermostat. There is more and more data coming about how ambient light affects sleep and kind of light pollution in general. So reducing or eliminating screen time in the evening hours and really reducing artificial light wherever it's possible, which kind of applies to the cool dark room concept as well. So artificial light at night disrupts melatonin production. So we really want to minimize that as much as possible. Now, if there is screen usage, my advice is to use like blue light blocking apps and switches on your technology. So most Apple products and even Android products now have like night mode settings that will basically block blue light at a certain time of the day. As it gets darker in the evening, it'll start to block the blue light. Now it's still other types of artificial light, but so it blocks some of the light, but you'll notice the screen kind of becomes more orangey. And that's kind of meant to help reduce the impacts on melatonin. So again, if screen time is needed or necessary or happening, that can be a way to kind of support melatonin production that way. And then coming back to full spectrum light first thing in the morning, this is the one we don't really talk about, is that what actually sets the rhythm is the darkness and the light. So making sure that we're getting a combination of both is really what's going to help with that rhythm and regulation of the melatonin cycle. Now in this slide set, I chose not to kind of get into the whole world of cortisol, but there's a lot to kind of discuss there in terms of helping with regulation and supporting cortisol regulation as well. But the main focus here would be melatonin. Melatonin also happens to be an antioxidant. So there are quite a few benefits to making sure that our body is either producing enough melatonin or that we end up getting enough supplementally, especially for children on the spectrum. Okay. So with all of that said, here's a little bit of information about how to get in touch. If you want more information, want to discuss what a consult would be like, I do offer free 15-minute conversations so people can ask specific questions and see if it would be a good fit for them to work with me. My website is available there. You can request appointments that way. And then for people who are watching this, whether you're in Colorado or not, there's a network of pediatric providers who work with, children on the spectrum through the Pediatric Association of Naturopathic Physicians, which also has like board certification. So there's a find an ND option on that page as well. So I just wanted to provide those two resources for people who are interested in learning a little bit more about me or other providers there. And then I will open the floor to any questions that you guys have.
I think because of the time, there aren't a lot of questions and we want to be sure and honor people's time. So I'm going to say that we can hold our questions and get in touch with you.
Wonderful.
Right? Because you've given us your information and use this PowerPoint. I will be sending it out to all of you that are participating. So you have all of these great resources because Meg, there's a lot of practical things for everybody and some specific things. There's just some slides I noticed that would be so great maybe to print out or take a picture of, so I have it on my phone when I'm going to the store or something, and I know that people will be able to use these resources a lot. So because of time, I'm going to keep us moving.
Great.
So you have some references here. Wonderful. Anything else on your?
No, that was it. I've just got the two references at the end if anybody wants to read the studies that were referenced in the paper. I know that's a little nitty-gritty for the parents, but if the providers want to look at that stuff. But I so appreciate the people that participated, and I'm happy to answer any questions, when you have them.
That's so great. Dr. Meg, thanks so much for your time. I'm going to stop the recording, and I know that people will get a lot as they listen to this again.
Great.